Kenya just froze a $2.5 billion healthcare deal with the United States, not because of money, not because of politics, but because of your medical records. HIV status, TB history, vaccination data, senior care files, and according to the High Court, all of it could be at risk. Here's what really happened and why this decision matters far beyond this deal. Welcome to Exigent Healthcare Inc. We break down the future of care from AI and senior health to national policy without noise and without spin. Today, we are unpacking why Kenya's High Court paused a landmark health partnership with the United States over one question governments everywhere are struggling to answer. Who controls your health data once it goes digital? Days ago, Kenya signed a $2.5 billion healthcare agreement with the United States. The breakdown is simple. The US committed $1.7 billion, Kenya committed $850 million. US Secretary of State Marco Rubio called it a landmark deal. Similar agreements have already been signed with Rwanda, Lesotho, Liberia, and Uganda. But almost immediately, Kenyan Consumer Group raised a red flag. Not about funding, not about aid conditions, but about what could happen to Kenyan medical data once international systems and analytics enter the picture. The High Court did not wait. It issued a temporary order stopping Kenya from taking any step that could lead to the transfer, storage, or sharing of sensitive health information until the case is fully heard. That alone tells you how serious this is. This ruling protects HIV and AIDS records, TB treatment history, vaccination data, senior care medical files, chronic disease records, hospital admissions, digital health platforms, cloud-stored patient information. This isn't paperwork. This is the most intimate information about millions of Kenyans. Modern healthcare now runs on AI systems. With enough health data, AI can predict disease outbreaks, model population risk, guide public health policy, track chronic illness, shape senior care outcomes, and here's the uncomfortable truth. AI is only as ethical as the hands that control the data. If health data is stored or analyzed outside of Kenya, we don't just risk privacy, we risk losing control of our health future. There's one group carrying the biggest risk, and barely anyone is talking about them: Kenya's seniors. For many older adults, their medical file isn't abstract data. It's the story of their illness, their survival, and their dignity. Seniors have the most medical records, the most hospital visits, and the highest dependency on caregivers. A data breach doesn't just violate privacy, it can lead to stigma, discrimination, or denial of care. In a digital healthcare future, protecting seniors is not optional. The case was brought by COFEC, a consumer rights organization. Their warning was direct. If a foreign government manages digital health infrastructure, cloud storage, pharmaceutical pipelines, or outbreak analytics, Kenya risks losing strategic control of its health system. The High Court agreed. These concerns were serious and paused the deal, not to kill it, but to demand clarity. President William Ruto says the Attorney General reviewed the agreement with a fine-tooth comb and that Kenyan law will always remain supreme. But courts don't pause billion-dollar deals over reassurance. They pause them over governance, structure, and enforceable protection. This moment is bigger than one agreement. Kenya is digitizing healthcare, rolling out SHA, integrating AI systems, and managing an aging population. If data governance is weak, everything else collapses. AI can transform Kenyan healthcare, but only if Kenya owns its data, controls its systems, and sets its rules.